Good morning. Am I audible? Good morning. Am I audible?
Yeah.
Okay, we'll start with topic. So in the last lecture, we had seen about tetanus. The next topic is AIDS. So what is AIDS? AIDS is the acquired immunodeficiency syndrome. Sometimes it also called as slim disease. Is a fatal illness caused by the retrovirus known as human immunodeficiency virus, that is HIV, which breaks down the body's immune system, leaving the victim vulnerable to the host for life-threatening opportunistic infections, neurological disorders, or unusual malignancies. So what is AIDS? AIDS is the acquired immunodeficiency syndrome. Sometimes it is called as slim disease. It's a fatal illness caused by retrovirus known as human immunodeficiency virus, which breaks down the body's immune system, leaving the victim vulnerable to different types of infections, like some opportunistic infections, neurological disorders, or unusual malignancies. Among the special features of HIV infections are that once they are infected, it is probable that person will be infected for life. It is not curable. AIDS can be called our modern pandemic, affecting both industrialized and developing countries. So once person is infected with HIV, it is probable that person will be infected for life. It has no cure. Then what is problem statement? In the world, it is recognized as an emerging disease only in the early 1980s. AIDS has rapidly established itself throughout the world and is likely to endure and persist well into the 21st century. AIDS has evolved from mysterious illness to a global pandemic, which has infected tens of million people in the world. WHO and UNAIDS define the different types of HIV epidemics as follows. That is, first is low-level HIV epidemics. Low-level HIV epidemics. Although HIV may have existed for many years, it has never spread to substantial levels in any subpopulation. Recorded infection is largely confined to individuals with higher risk behaviors. For example, sex workers, drug injectors, or men having with sex with other men. Numerical proxy. HIV prevalence has not consistently exceeded 5% in any defined subpopulation. So it is called as low-level HIV epidemics. Means only 5% prevalence. The next is concentrated HIV epidemics. So HIV which has spread rapidly in defined subpopulation but is not well established in the general population. This epidemic state suggests active networks of risk within the subpopulation. And here prevalence is consistently over 5% in at least one defined subpopulation, but is below 1% in pregnant women in urban areas. So it is called as concentrated HIV epidemics. Its prevalence is more than 5% in defined subpopulation. Then generalized HIV epidemics. In generalized epidemics, HIV is firmly established in the general population. Although subpopulation at high risk may contribute disproportionately to the spread of HIV, the sexual networking in the general population is sufficient to sustain an epidemic independent of subpopulation at higher risk of infection. Its numerical proxy, that is its prevalence, consistently over 1% in pregnant women. So what are three types? First is low-level HIV epidemics, that it never spread to substantial levels in any subpopulation, and its prevalence is not exceeding 5%. Concentrated HIV epidemics, it is well established in subpopulation but not in general population, and its prevalence is more than 5% but below 1% in pregnant women. And generalized HIV epidemics, it is established in the general population, and its prevalence is over 1% in pregnant women. This HIV incidence, that is number of new infections in a population per year. What is the meaning of incidence? Incidence is number of new patients in a population per year. It is called as incidence. So this HIV incidence is the key parameter that prevention efforts aim to reduce. Since newly infected person contribute to the total number of persons living with HIV, they will progress to a disease and death over a time and are potential source of further transmission. So since 1997, the year in which annual new infections peaked to 3.2 million cases globally, and the number of new infections has fallen to 2.3 million in 2012. So this reduction in HIV incidence reflects natural trend of epidemic as well as the result of prevention programs, resulting in behavioral changes in different contexts. So most new infections are transmitted heterosexually, although risk factors vary. In some countries, men who sex with men, injecting drug users, sex workers are at significant risk. Although HIV testing capacity has increased over a time, enabling more people to learn about their HIV status. The majority of people with HIV are still unaware about their infective status. Women represents about half of all people living with HIV worldwide. and more than half in sub-Saharan Africa. So more cases are in sub-Saharan Africa. HIV is the leading cause of death among women in reproductive age. Why? Because gender inequalities, differential access to services, sexual violence increase women's vulnerability to HIV, and women, especially younger women, are biologically more susceptible to HIV. So these are the reasons why leading cause of death in women is high in reproductive age. In 2013, WHO issued revised treatment guidelines recommending earlier initiation of antiretroviral therapy at CD4 count of approximately 500 cells per mm³. This new criteria increased the total number of people medically eligible for therapy from 16.7 million to 25.9 million, an increase of 9.2 million in low and middle income countries. In 2011, WHO member states adopted a new global health sector strategy on HIV/AIDS for 2011-15. And it outlines 4 strategic directions for next 5 years. Optimize HIV prevention, diagnosis, treatment, and care outcomes. Then leverage broader health outcomes through HIV responses. Build a strong and sustainable health system. Address inequalities and advance human rights. So these are their aims. Global Health Sector Strategy on HIV/AIDS for 2011-15. Then in India, the epidemic shifts from highest risk group, that is commercial sex workers, homosexual men, drug users, to the breach population, that is clients of sex workers, STD patients, migrant population, population in conflict areas, and partners of drug users, and then to the general population. So there is a time lag of 2 to 3 years between the shift from one group to the next. The trend indicates that HIV infection is spreading in 2 ways, from urban to rural areas and from individuals practicing high-risk behavior to the general population. And data from antenatal clinics indicates rising HIV prevalence among women, which in turn contribute to increasing HIV infections in children. Then provisional estimates for year 2012 show that there were 20.89 lakh people living with HIV/AIDS with estimate adult HIV prevalence of 0.27%. Information from person testing positive for HIV at the integrated counseling and testing centers across the country during 2011 to 12 shows that 82.2% of HIV infections are still occurring through heterosexual route of transmission. And this is routes of transmission of HIV in India in 2011-12. So 1% causes are due to blood and blood products. 1.7% are due to injecting drug use. 1.5% homosexual. 5% parent to child. 2.7% is unknown. And large part, that is 88.2 are heterosexual causes. So these are route of transmission. Then patterns of HIV epidemic at national levels. So at the national level, the overall HIV prevalence among different population groups in 2010 to 11 continues to portray the concentrated epidemic with high prevalence of HIV in high risk groups. Then primary drivers of HIV epidemic in India are unprotected paid sex or commercial female sex workers, unprotected sex between men, injecting drug use. Then it is estimated that there are 8.68 lakh female sex workers, 3.13 lakh men who have sex with men with high risk, 70,000 are transgenders, 1.77 lakh injecting drug users in India, and 110 lakh are breech population, which includes 80 lakh migrants and 30 lakh truckers. So see the population of HIV persons or persons who are responsible for spreading HIV. Then the adult 15 to 49 years, HIV prevalence is estimated at 0.27% for the year 2011, 0.32 among males and 0.22 in females. The prevalence among young population at national level is estimated at 0.11% for 2011 and equal among men and women. All these epidemiological numbers, it is not mandatory to remember it. It is only for your information. All the numbers, that how it is prevalent. So there is no need to remember this percentage. So there is a stable decline in most states, while rising trends are noted in Jharkhand, Odisha, Tripura and Uttarakhand. India is estimated to have around 1.16 lakhs annual new infections among adults and 14,500 among children. Then about 1.48 lakh people died of AIDS related causes in 2011. And it is estimated that the scale up of free ART since 2004 has saved over 1.5 lakh lives in country till 2011. And during 2010-11, none of the states have shown HIV prevalence of 1% or more among ANC clinic attendance. So this is positive thing, that its prevalence is decreasing due to awareness or due to starting of free ART, so that death rate is decreased. Then what are the epidemiological features? This is important for you. So epidemiological features includes agent factor. First is agent. So when the virus was first identified, it was called as lymphadenopathy associated virus by the French scientist. Then the researchers in USA called it as human T-cell lymphotropic virus 3, that is HTLV3. And in May 1986, the International Committee on the Taxonomy gave it a new name, that is human immunodeficiency virus, that is HIV. So what was the first name of HIV virus? That is lymphadenopathy associated virus. Then human T-cell lymphotropic virus 3. And at the last, it is named as human immunodeficiency virus. Then meaning of HIV. What is the meaning of human? That it can live only in humans, not in animals. So human, its meaning is that it can live only in humans. Then meaning of immunodeficiency, it damages the immune system of people it affects. So it is called as immunodeficiency. It causes the immunodeficient state. And virus, that is, it is retrovirus. So this is the meaning of human immunodeficiency virus. So it occurs only in human. It damages the immune system of people it affects. And it has retrovirus, that is RNA virus. So this, you can see the diagram, the structure of HIV virus. So the virus is 1/10,000 of millimeter in diameter. So small it is. 1/10,000 of millimeter in diameter. It is a protein capsule containing 2 short strands of genetic material, that is RNA and enzymes. The virus replicates in actively dividing T lymphocytes. And like other retroviruses, it can remain in lymphoid cells in a latent state that can be activated. So the virus has unique ability to destroy the human T4 helper cells, which are the subset of human T lymphocytes. And after the virus is able to spread throughout the body. So the virus is 1/10,000 of millimeter in diameter. It is a protein capsule containing 2 shots of strands of genetic material, that is RNA and enzymes. This virus replicates in actively dividing T4 lymphocytes. And like other retroviruses, it can remain in lymphoid cells in a latent state that can be activated. The virus has unique ability to destroy the human T4 helper cells, which are the subset of human T lymphocytes, and the virus is able to spread throughout the body. It can pass through the blood-brain barrier and can destroy some brain cells also. So this may count for certain of the neurological and psychomotor abnormalities which are observed in AIDS patients. This HIV mutates rapidly. This HIV mutates rapidly and new strains are continually developing. There are 2 types of HIV, that is HIV-1 and HIV-2. And this virus is easily killed by heat. And it is readily inactivated by ether, acetone, ethanol, beta-propiolactone, but it is relatively resistant to ionizing radiation and ultraviolet light. So HIV virus can pass through the blood-brain barrier and then it can destroy some brain cells. So this accounts for certain neurological and psychomotor abnormalities. As it is virus, it mutates rapidly and new strains are continuously developing. There are 2 types of HIV, HIV-1 and HIV-2. The virus is easily killed by heat. It is readily inactivated by ether, acetone, ethanol, and beta-propiolactone. But it is resistant to ionizing radiation and ultraviolet light. Then second one is reservoir of infection. So these are the cases and carriers. Once a person is infected, the virus remains in the body lifelong. The risk of developing AIDS increases with time. Since HIV infection can take years to manifest itself, the symptomless carrier can infect other people for years. So what is the reservoir? The reservoir are cases and carriers. Once a person is infected, the virus remains in the body lifelong. The risk of developing AIDS increases with time. And since HIV infection can take years to manifest itself, the symptomless carriers can infect other people for years. Then third one is source of infection. The virus has been found in greatest concentration in blood, semen, and CSF. And lower concentration have been detected in tears, saliva, breast milk, urine, cervical and vaginal secretions. HIV has also been isolated in brain tissue, lymph nodes, bone marrow cells, and skin. So what are the sources of infection? The virus has been found in greatest concentration in blood, semen, and CSF. Lower concentration have been detected in tears, saliva, breast milk, urine, cervical and vaginal secretions. HIV has also been isolated in brain tissue, lymph nodes, bone marrow cells, and skin. Then host factors. So age. Most cases have been occurred among sexually active persons aged from 20 to 49 years. This group represents the most productive members of the society. Then sex. In North America, Europe, and Australia, about 51% of cases are homosexual or bisexual men. In Africa, the picture is very different. The sex ratio is equal. Certain sexual practices increases the risk of infection more than others. For example, multiple sexual partners, anal intercourse, and male homosexuality. Higher rate of HIV infection is found in prostitutes. Then higher risk groups are male homosexuals, bisexuals, heterosexual partners, intravenous drug abusers, transfusion of recipient of blood and blood product, hemophilic patients, and clients of STD. Then immunology. What actually it affects? As it is immune system disorder associated with HIV infections or AIDS are considered to occur primarily from gradual depletion in specialized group of white blood cells that is lymphocytes, which are called as T helper or T4 cells. Full name of T4 T helper cells is CD4 plus T lymphocytes and is also commonly known as CD4 plus cells. So these cells play a key role in regulating immune responses. So what HIV causes? It primarily causes from gradual depletion in specialized group of white blood cells called as T helper or T4 cells. The full name of T helper cells are CD4 plus T lymphocytes. It is also commonly known as CD4 plus cells. And these cells play a key role in regulating our immune responses. Then next, HIV selectively infects T helper cells apart from several other cells in immune system such as B cells, macrophages and nerve cells. It mainly affects only and only T helper cells. Virus reproduces, the infected T helper cells are destroyed. So consequently, people with AIDS tend to have low overall white blood cell counts. So low WBC count. Whereas healthy individuals have twice as many helper cells as suppressor cells. In the AIDS patient, the ratio is reversed. A decreased ratio of T helper cells to T suppressor cells may be an indirect indicator of reduced cellular immunity. These T cells are responsible for cellular immunity. So, the decreased ratio of T helper cells to T suppressor cells is an indicator of reduced cellular immunity. And one of the most striking features of immune system of patients with AIDS is profound lymphopenia. That is, the total lymphocyte count is below 500 cubic mm. So it is the alteration in T cell function that is responsible for development of neoplasms, development of opportunity infections, and the inability to mount a delayed type of hypersensitivity response. So alteration in T cell function is responsible for development of neoplasm, development of opportunistic infections, and the inability to mount a delayed type of hypersensitivity response. Then the lack of obvious immunological response by the host to virus is one of the problems confronting scientists. That is, those with antibodies to HIV usually will have too few HIV antibodies, and these antibodies are also infective against virus. So that till today there is no any vaccine for HIV because the patient who is infected with HIV has too few HIV antibodies, and these antibodies also are ineffective against virus. Then mode of transmission. The meeting will end in less than 1 minute, so you can rejoin again for 20 minutes.
जल्दी अब लिखा
The mode of transmission. The causative virus is transmitted from person to person, most frequently through sexual activity. And the basic modes of transmission are: first is sexual transmission. So AIDS is the first and foremost a sexually transmitted disease. We called it as a STD, sexually transmitted disease. Any vaginal, anal, or oral sex can spread HIV. Every single act of unprotected intercourse with an HIV infected person exposes the uninfected partner to the risk of infection. Then the size of the risk is affected by a number of factors, including the presence of STD, the sex and age of uninfected partner, the type of sexual act, the stage of illness of infected partner, and the virulence of HIV strain involved. So these are the factors which are included. A European study of heterosexual couples in which only one partner was infected at the start suggests that chances of transmission of HIV infection from male to female is twice as likely as from female to male. So generally, women are more vulnerable to HIV infections because of larger surfaces exposed, and semen contains higher concentration of HIV than vaginal or cervical fluids. For all forms of sex, the risk of transmission is greater where there are abrasion of the skin or mucous membrane. So it has a direct entry due to abrasion of the skin or mucous membrane. For vaginal sex, the risk is greater when woman is menstruating. Exposed adolescent girls and women above 45 years of age are more prone to get HIV infections. The thinning of mucosa at menopause is believed to lessen the protective effect, so that there is a risk is more in above 45 years of age. The risk of transmission is 8 to 10 times higher if an STD such as syphilis, chancroid, herpes, which causes ulceration in the genital or perineal region of an uninfected partner, and it becomes far easier for HIV virus to pass into his or her tissues. If other STDs are present in patient, then the transmission risk is more, 8 to 10 times. As for HIV infected people, they are more infectious to others in the very early stages before antibody production, that is during the window period. And when the infection is well advanced, because levels of virus in blood at time is higher than at other times. These HIV infected people are more infectious to others in the very early stages before antibody production, that is during the window period, that when they are on asymptomatic, and when the infection is well advanced because level of virus in the blood at time is higher than at other times. Then second mode of transmission is blood contact. So AIDS is also transmitted by contaminated blood transfusion of whole blood cells, platelets, and factor 8 and 9, which are derived from human plasma. So second way of transmission is blood contact. So it is transmitted by contaminated blood of whole blood cells, platelets, or factor 8, factor 9, which are derived from human plasma. Contaminated blood is highly infective when introduced in large quantities directly into the bloodstream. The risk of contracting HIV infection from transfusion of a unit of infected blood is estimated to be over 95%. So risk of contracting HIV infection from transfusion of infected blood is over 95%. Since the likelihood of HIV transmission through blood depends on the dose of virus injected, the risk of getting infected through a contaminated needle, syringe, or any other skin piercing instrument is very much lower than with transfusion. Nevertheless, among drug users who inject heroin, cocaine, or other drugs, this route of transmission is significant because exposure is repeated so often, in some cases several times a day. As a result, needle sharing by drug users is a major cause of AIDS in many countries, in both developed and developing countries. And in some, it is predominant cause. Any skin piercing, including injections, ear piercing, tattooing, acupuncture, or scarification, can transmit the virus if the instrument used have not been sterilized and have previously been used on an infected person. So any skin piercing, including injections, ear piercing, tattooing, acupuncture, or scarification, can transmit the virus if the instrument used have not been sterilized and have previously been used in infected person. Then third way of transmission is maternal to fetal transmission. So HIV may pass from an infected mother to her fetus through the placenta or to her infant during delivery or by breastfeeding. In the absence of any intervention, rates of this form of transmission can vary from 20 to 25%. Transmission of HIV from mother to child can be prevented almost entirely by antiretroviral drug prophylaxis, that is ART, elective cesarean section before the onset of labor and rupture of membrane, and by refraining from breastfeeding. There is no evidence that HIV is transmitted through mosquitoes or any other insects. Casual social contact with infected person, including within household or by food or water. So we'll revise today's lecture. So we are seeing about AIDS. What is AIDS? Acquired immunodeficiency syndrome. It is also called as slim disease. And it is a fatal illness caused by the retrovirus known as human immunodeficiency virus, which breaks down the body's immune system, leaving the victim vulnerable to host for life-threatening opportunistic infections, neurological disorders, unusual malignancies. Among the special features of HIV are that if it is once infected, it is probable that the person will infected for life. Then this is problem statement, epidemiological numbers, 3 types of HIV epidemics, that is low level HIV epidemics, that is it never spread to substantial levels in any subpopulation and it not exceed 5%. Concentrated HIV epidemics, it is not well established in general population but well established in subpopulation and its prevalence is consistently over 5% but less in or below 1% in pregnant women. Then generalized HIV epidemics, it is firmly established in general population and its prevalence is over 1% in pregnant women. Then these are some numbers, how it affects. Then these are the routes of transmission of HIV in India as calculated in 2011 and 12. So 88.2% causes are due to heterosexuals, 2.7% causes are unknown, 1% are blood and blood product, 1.7% are injecting drug use, 1.5% are homosexuals, and 5% from parent to child. And these are again numbers. Epidemiological features. First is agent factor. Agent, as you know, its agent is human immunodeficiency virus, that is HIV. But initial name of HIV virus was lymphadenopathy associated virus, that is LAV. Then human T cell lymphotropic virus 3, that is HTLV3. And last one is HIV, that is human immunodeficiency virus. The meaning of HIV is H means human and it can live only in humans, not in animals, only in humans. Then immunodeficiency, it damages the immune system of people it affects. And virus is retrovirus, that is RNA virus. So its name is human immunodeficiency virus. This is the structure of HIV virus. You can see in the image. Then the virus is 1/10,000 millimeter of diameter. It is a protein capsule containing 2 short strands of genetic material, that is RNA and enzyme. This virus replicates in actively dividing T4 lymphocytes and can remain in lymphoid cells in latent state, that is in inactive state, and that state can be activated. The virus has ability to destroy human T4 helper cells, which are the subset of human T lymphocytes. The virus is able to spread throughout the body. It can pass the blood-brain barrier and can destroy some brain cells, which leads to neurological and psychomotor abnormalities. As it is a virus, it mutates rapidly. The new strains are continuously developing. There are 2 types of HIV, HIV-1 and HIV-2. This virus is easily killed by heat. It is readily inactivated by ether, acetone, ethanol, beta-propiolactone, but it is resistant to ionizing radiation and ultraviolet light. The reservoir of infection are cases and carriers. Source of infections, mainly it is found in great concentration in blood, semen and CSF, and also lower concentration in tears, saliva, breast milk, urine, cervical and vaginal secretions. Then host factors, age is mainly from 20 to 49 years. Sex, mainly homosexual, bisexual, multiple sexual partners, anal intercourse, male homosexuality, prostitutes. Higher risk groups are male homosexuals and bisexuals, heterosexual partners, intravenous drug users, transfusion of recipients of blood and blood products, hemophilic patients, and clients of STD. Immunology, it mainly affects on T4 helper cells. These T4 helper cells are also called as CD4 plus lymphocytes and commonly known as CD4 plus cells. These cells play a key role in regulating the immune response. So it mainly infects T helper cells. When the virus reproduces, the infected T helper cells are destroyed. So HIV patients or AIDS patients have low overall white blood cell count. A decreased ratio of T helper cells to T suppressor cells, that is the indirect indicator of reduced cellular immunity. So WBC count may be below 500 cubic mm, and the alteration in T cell function responsible for development of neoplasm, development of opportunistic infections, and inability to mount a delayed type of hypersensitivity response. Then mode of transmission, first is sexual transmission. It may be vaginal, anal or oral sex. Then blood contact, that is transmission of contaminated blood. Then needle users, drug abusers, and maternal fetal transmission. So it is not transmitted by mosquitoes or any other insect. Casual social contact with infected person, including within household, and by food or water. So next lecture will continue same topic. If any doubt till here, you can call me or message me. Thank you. You can leave the meeting.